what a great show we have lined up for you today. Let's see what's up first.
Going to see the dentist isn't something most people look forward to. That goes for children, teens, and adults alike. But one local dentist office wants to see all of their patients smiling before they come in, just as much as they're smiling after their visit.
My name is Dr. Janet Schrode. I'm a pediatric dentist and an orthodontist. I founded TLC For Smiles in 2008 with a mission to make dental care fun and enjoyable for children. We also take care of the entire family's orthodontics. We see adults, children, and teens, and we treat everybody with tender, loving care.
Having a healthy smile doesn't happen by chance. Early visits to a dentist play a huge role.
Babies should see a pediatric dentist no later than 12 months of age. That's because at those early visits, we're helping parents to learn everything they need to do to avoid their children getting cavities. As you know, toddlers sometimes don't want their teeth brushed and flossed, and so one of the things we do is we actually teach parents how to safely restrain their children so that they can brush and floss thoroughly. Another thing that we review is the proper nutrition cycle and teaching parents to focus on whole foods, avoid processed foods, avoid sugar in the diet. So we do a lot of guidance to parents to help them keep their kids healthy. At TLC For Smiles, we're actually looking at how teeth are erupting and how jaws are developing at every single visit. But in general, all children should actually have an orthodontic consultation around 7 to 8 years old. And that's because we can intervene early and we can help the teeth erupt in a straighter position and we can help with the jaws growing. All children and adults should be seen by the dentist at least twice a year. And that's because if we find problems early, it's always easier and less expensive to take care of it early rather than late.
Many of us have apprehensions and even misconceptions about going to see a dentist. What are some of the more common misconceptions you've come across?
Some people think that it's not a big deal if baby teeth have cavities and that these cavities don't need to be treated, but actually cavities can lead to pain, infection, even permanent damage to the teeth, as well as many orthodontic problems. So we actually do take care of filling teeth if they have cavities, even if they're baby teeth. Some people think that all dentists are the same, but the truth is that children's dentists and orthodontists actually go to school full-time for 2 or 3 extra years. That means that when you see a specialist, you actually are seeing someone with a lot more training than a general dentist. Some people think the right time to see an orthodontist is when all the baby teeth are gone, and unfortunately, that's a big mistake because orthodontists can help so much if we have the opportunity to see kids early. So for example, we want to start seeing them around age 7 or 8 years old so we can help guide the teeth in and that we can help the jaws grow together the way that they should. Orthodontics is not just for teenagers. In fact, at our office, almost 50% of our patients are adults, and that's because we specialize in Invisalign, which is the clear way to straighten teeth, and we also actually place braces behind the teeth using in-brace. Those are hidden braces.
We all want the very best for our children. So what are some of the things that all parents should be aware of when it comes to pediatric dentistry?
The other day, I met a beautiful teenage girl who was so sad about her smile. What happened is that she had a baby canine that did not fall out when it should, and her permanent canine wound up ruining her smile. That terrible thing could have been easily avoided if her baby tooth had been taken out at the right time. The ideal age to remove wisdom teeth is actually around 15 years old. And that's because wisdom teeth removal at that age is a lot more comfortable, less pain, less side effects, fewer infections, and just a much better time than when people are adults. Traditionally, cavities are treated by surgery, where we actually carve out the diseased part of the tooth. But nowadays, we actually can use silver diamine fluoride, which is actually a medicine that can be applied to tooth decay, and it helps to arrest the decay. So it's a different way of treating cavities.
So if you or your child need help achieving your best smile, let the caring people at TLC For Smiles be your first stop on the road to great oral health.
To have a healthy and beautiful smile, a person's smile journey has to start around 12 months old and have regular visits twice a year, all the way up into adulthood.
For more information about TLC For Smiles, visit their website at tlcforsmiles.com. And of course, visit our website at thebalancingAct.com.